spinal lesions. The authors list organic disorders reportedly related to spinal lesions of the affected by chiropractic manipulation. These include abdominal discomfort, asthma, thank you. Cardiac arrhythmia, colic, constipation, dysmenorrhea, high blood pressure, low blood sugar, and hyperinsulinism, migraine, pulmonary disease, ulcers, vertebral autonomic dysfunction, and I cut off half of it because I couldn't fit the rest of it. Blah, 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 blah. So if you have a lesion due to a subluxation, it's going to affect what? Everything, right? How do I know that to be true? Real doctor said it. Right? Relationship of dorsal cervical posture deficiencies to the cardiac disease, especially from middle life onwards. Okay? In this paper, the author identifies a 100% relationship between dorsal cervical posture and cardiac disease. Okay? So this isn't like the other one. The other one was talking about arthritic changes, but the bottom line is if I have forward head posture around the shoulder, it isn't rocket science, right? What two organs am I affecting? Right, so what's happening to the messages that go to those organs? They get healthier or sicker? Sicker. You want to get a sicker heart or a sicker lung? No. The best way to get them healthier is what? Adjust, which means what? I'm removing, because the organs are designed to be what? All the time. The only reason they're not healthy, or one of the only reasons they're not healthy, at least the foundation is a sick or diseased or dysfunctional what? Nervous system. That's it. Real doctors said that. They were scientists, right? Which means what they say is correct. Spine and heart. The flat thoracic spine or straight back syndrome is described as accompanying heart murmurs, pulmonary problems, and other forms of cardiopulmonary disease. How important is it to have a healthy nervous system? Very. Number one disease in the United States is heart disease, right? Somatic component to heart disease. Numerous observations reveal that upper thoracic subluxations are common in heart patients. The subluxations appeared months or years before the cardiac symptoms. Cox reports that many heart patients reported heart disease following thoracic trauma with marked subjective and objective improvement following care. Out of 150 cases, no cardiac deaths occurred during spinal corrective treatment program. How awesome is it and what we do? What'd I tell you? It's scientific philosophy, crazy extravaganza Saturday morning, right? Are you getting pissed? Are you getting excited? Are you creating some certainty? Is your short sharp? Do you want to go Monday and just scream, oh my God, I'm freaking awesome? You want to do it? Everybody needs to be under care. Are you awesome? Are you great? Great. Are you a world changer? World changer. Can you prove it? Yes. Is it just something you're making up? Well, God's going to be expressed better than man. I say it all the time. Yeah, but listen. Let me explain it in pragmatic terms too. Your brain's not talking to your body because it's choked off. I need to relieve some pressure so your brain can talk better to your body. What's the problem with that concept? How does that affect you negatively at all? Right? How can somebody look at you and go, I don't believe in chiropractic. Really? Don't you just want to punch them? This is what I do. Hey, Jim, open and close your hand for me for a minute. This is what I'll say to him, all right? How can you do that?
My brain tells my body.
Yeah, what's it doing? So your brain's sending what to your hand?
Signals.
Yeah, so if I put pressure on that wire, that nerve that allows those messages to go through, what's going to happen to the ability of your hand to open and close?
Diminish.
If it stays there a long time, do you think your hand's going to get healthier or sicker?
Sicker.
Aren't those same nerves telling your heart, lung, pancreas, kidney what to do? If I press in those, aren't they going to get sick?
Yeah.
Right? So if I relieve the pressure, if that vertebrae's out causing that pressure, if I relieve the pressure, what's going to happen to the signals?
Get better.
So what's going to happen to the healthier body?
Better.
What's that got to do with belief? You don't even need to believe in it. It's a scientific fact. No, Lane. Don't ever ask me that question again. Right? Palpatory testing for somatic dysfunction in patients for cardiovascular disease. Again, Journal of American Osteopathic. They're not real doctors. They're almost real doctors. I'm just kidding. The author found 108 patients with upper thoracic subluxations commonly associated with heart disease. Spinal palpation alone was 76% accurate in indicating the presence of cardiac disease. Data from 21 studies demonstrated the presence of a T1 to T4 subluxation in cases of heart disease. right? Shortly after Dr. Palmer's first chiropractic case restoring hearing to the deafman, he came across a patient with heart troubles and were not improving. I examined the spine, found a displaced vertebrae pressing against the nerves which innervated the heart. I adjusted the vertebrae, gave immediate relief. Nothing accidental accrued about this. Then I began to reason that if two diseases so dissimilar as deafness and heart trouble came from impingement and pressure on nerves, were not other diseases due to similar cause. D.D. Palmer.
Awesome.
Awesome? Was he right on? Was he courageous?
Best friend gave me the best advice. He said each day's a gift and not a given right.